Today's an informational educational series, and we are so lucky to have the Keto-Mojo team with us today to educate us on the importance of measuring glucose and ketones, what these biomarkers mean, how to interpret them, and how you can use them in navigating your metabolic journey. Presenting on behalf of Keto-Mojo today is Franziska Spritzler. She is a registered dietitian and education specialist, and she's also an expert in ketogenic and low carb nutrition. So she serves as the medical science liaison at Keto-Mojo, and there she helps bridge the gap between research, clinical practice, and patient education. Franziska is known for translating complex medical health science into practical, evidence-based guidance that empowers people to improve their health through sustainable lifestyle change. And so we are so lucky to have them here today. Welcome, Franziska.
Hello, everyone. Welcome to Monitoring Ketosis for Mental and Metabolic Health. I am Franziska. She gave me a very nice introduction. I'm a registered dietitian and certified diabetes care and education specialist, as Emily said. And I've been the medical science liaison at Keto-Mojo for a little over 2 years. And before that, I worked at Diet Doctor as a writer. And I had my own clinic where I did exclusively low carb and ketogenic therapies for many years. I've been following this lifestyle myself for about 15 years. And my goal is to empower individuals and clinicians through evidence-based nutrition and personalized care. So today we're going to be comparing different ketone testing methods, learn how ketone and GKI monitoring can support ketogenic metabolic therapy for brain health, explore target ketone and GKI ranges for mental health conditions, and get tips on how to test and monitor ketones and glucose at home. Now, before I get into why we want to test ketones, how beneficial it can be, I want to take a step back and talk about nutritional ketosis a bit. And I realize we have a mixed audience, and some of you may know this like the back of your hand, but here's a little refresher. And for anyone who's new, we have a default fuel in our body. It's glucose, and it travels in the bloodstream to different organs. And that's why we call it sometimes blood glucose or blood sugar. But there's a backup system when our glucose levels are low. When we eat very few carbs, as on a ketogenic diet, or if we fast for a number of hours, our glucose levels go down. And our pancreas responds by changing its output of two key hormones, insulin and glucagon. It reduces output of insulin and increases output of glucagon into our system. And that prompts the fat stores on our body to release free fatty acids into the bloodstream, and they travel to the liver, where they build up and are converted into ketones, which then enter the bloodstream. And if you continue eating a ketogenic diet or fasting, over the next few days, the levels of ketones will build up in your blood until they reach the threshold for nutritional ketosis. And for the first few days, your body's not that efficient at using ketones. It's still kind of tied to using glucose. But by about day 4 on, your body becomes much more efficient at using fats and ketones to fuel its organs. Now, why would anyone want to change their fuel system? If they've been using glucose for years, why would they want to switch to using fats and ketones? Well, there are a number of reasons, and a lot of them have to do with the effects of nutritional ketosis on the mitochondria. So this is a beautiful picture of a mitochondria in here, and these are what are called the powerhouse of the cell. And that's because that's where energy is produced. They have a number of other important functions like keeping house in the cell, making sure that anything old and damaged is removed, and cell communication. But their main function is to transform food into energy. So all the food that you eat is broken down into components like glucose and fatty acids and ketones, and those enter the mitochondria and produce energy, or ATP, which is a technical term. And I'm going to keep this not very technical because it was my understanding this audience is going to mainly be people who are living with mental or neurological conditions and their caregivers. So I'm going to be as untechnical as possible while still explaining it thoroughly. But at any rate, you are changing your fuel source. And people who have mental health conditions or neurological conditions often can't use glucose as effectively as they can use ketones. Their brains prefer to use ketones. So on a ketogenic diet, you will be using fats and ketones as your main fuel sources. And the brain can only use glucose or ketones. It can't use fats. Many of the other organs can use fats or ketones. However, once you have been in nutritional ketosis for a while, you actually become better able to switch between different fuel sources. So you can change from using fats and ketones to using glucose when it's present. So if you're following ketogenic metabolic therapy, you're going to primarily be using fats and ketones and burning it. But if you do happen to eat carbohydrates, which I'm not recommending, but if you do, your body will switch to burning the glucose and until it's processed, and then it will switch back pretty quickly into fat burning and ketosis. You don't have to go through keto adaptation again. This is a hallmark of healthy metabolism, is to be able to switch between the two different fuel sources pretty easily. And long-term, ketosis can lead to what is known as mitochondrial biogenesis, or the formation of new, healthier, more resilient mitochondria that are better able to transform food into energy. And there are some effects throughout the body that nutritional ketosis can give you, and also one specific ketone body, beta-hydroxybutyrate, which I'll be talking about a lot in this presentation. So it can be systemic throughout your body, but particularly for the brain in people who have mental health and neurological conditions. Being in ketosis and BHB itself can help to reduce inflammation, neuroinflammation, which is at the root of many psychiatric and neurological conditions. And it can also improve insulin signaling in the brain, and it can enhance neuroprotection. And that just means protecting the brain from things like oxidative stress and increasing levels of brain-derived neurotrophic factor, or BDNF, which is involved in mood, learning, and memory. So you can see there are many, many benefits to switching from using glucose to using fats and ketones as your main fuels. So I'm going to be talking about KMTs. That's the abbreviation for ketogenic metabolic therapies. And these are dietary and lifestyle interventions that are designed to normalize insulin levels, increase fat metabolism, and promote the production of ketones. And the goal of every KMT is to achieve and sustain nutritional ketosis. And this can be done in a number of ways: through diet, fasting, and exercise, sometimes a combination of all of them. But the most efficient way to get into ketosis and stay there is by changing your diet, following a ketogenic diet that is high in fat, very low in carbs, and adequate in protein. Now, the traditional way to manage mental health conditions is through conventional psychiatry, which is based on medications, usually one, sometimes more than one medication, coupled with therapy of some type. And then diet and sleep and exercise play a small supporting role. But in metabolic psychiatry, that shifts, where we're using nutrition, therapeutic nutrition, as the foundation. This is where it all starts. This is the most important thing, is changing your diet. And then therapy, sleep, and exercise play strong supporting roles, and medications play a lesser role. People who are following a ketogenic diet to treat a mental illness may still need to take medication, but they'll probably be taking a much smaller dose, or they may only be taking one when they were taking 5, or they may switch to a medication that doesn't have the metabolic health impacts that a lot of these medications have. In some cases, they may be able to discontinue medications altogether if they go into remission, but the foundation is always going to be nutrition. Now, if we're following a well-formulated ketogenic diet that is rich in whole foods, contains minimal to no processed foods, plenty of healthy fat, is adequate in protein, and very low in carbs, do we really need to test ketones? Isn't following a diet like this enough? Well, if your goal of being on a KMT is to get into nutritional ketosis so you can get all the benefits, then it's important to know that you're actually in nutritional ketosis. And the only way to know for sure is to test. And KMTs have a biomarker. They're actually the only medical therapy that has a defined biomarker that lets you know that you are achieving that metabolic state. That's ketones that you measure. So monitoring ketones is important for understanding whether you have successfully entered ketosis and also the level of ketosis that you're at, because there's a pretty big range for nutritional ketosis. And what one person may need, like at the lower level of ketosis, maybe for weight loss or for reversing prediabetes, that level of ketosis may not be enough for somebody who is trying to treat or even possibly put into remission a serious mental illness. You may need to be at a higher level, and testing allows you to see whether you're at that level and also whether you're maintaining it, because you don't just want to achieve the level one day and then the next day you're not in ketosis anymore. It's important to sustain that level of ketosis to get the benefits in order to get symptom improvement and just feel better overall. You can also see at what level you personally feel best. And we'll talk about specific levels a little bit later. But it can also tell you if what you're doing today is still working. You know, what you may get into a state of nutritional ketosis and be just fine for a while, but what's working today may not work the same way in 3, 6, or 12 months from now. So by testing, by first making some changes, maybe changing your eating window to make it shorter, or cutting back on carbs a bit, or changing one of the foods you eat, and then testing a few days later to see if that has gotten you back into that optimal level of ketosis for you. That's a really powerful way of taking control of your ketogenic metabolic journey. Okay, now we're going to talk about different ways to monitor ketones. There are 3 ketones and 3 different ways to measure them. Acetoacetate is the first ketone. It's produced in the liver, and it's sometimes called the parent ketone because the other ketones are created from it. And this one is measured in the urine. Acetoacetate can spontaneously convert into acetone, and this is a volatile compound that is exhaled on the breath. So we measure it in the breath. And acetoacetate can also enzymatically be converted to beta-hydroxybutyrate, and beta-hydroxybutyrate can convert back into acetoacetate. And beta-hydroxybutyrate, I talked about a little bit earlier, it's abbreviated BHB, and it's measured in the blood. So what is the right test or the best test? Urine, breath, or blood? Well, it depends. And I'll talk about each of the methods, and then you can decide which one you think is most appropriate for you. Let's start with urine testing. So this is acetoacetate, and it's measured in milligrams per deciliter, and it's very easy to do. You simply purchase some urine strips, and you urinate into a cup and stick the strip in, or you can alternatively just urinate right on the stick. And very quickly, the color will change at the end of the strip to reflect the presence of acetoacetate and how much is there. So a negative reading would be beige, and then different shades of pink, all the way down to purple or dark purple, which means a large amount of acetoacetate is present in your urine. So there are some benefits to testing urine ketones. First, it's easy to teach and perform. It's not expensive. The strips that you buy are not expensive. It's not invasive, and it's pain-free. Downsides are that it's influenced by hydration. So especially at the beginning of a ketogenic diet, you may remember if you have done it a while ago, or if you're pretty new to keto, that you tend to urinate a lot at the very beginning. And when you urinate a lot, you're losing a lot of water, and the acetoacetate can be concentrated in the urine and give you a much darker color than your true ketone level. But more importantly, over time, these strips become less and less reliable, because as you become keto adapted, you start to convert more of the acetoacetate to beta-hydroxybutyrate in your blood, and less of it is excreted in your urine. So you may be in a moderate to deep level of ketosis, but you may see very little change in color on the strip, where it's only a very faint pink. So that's misleading. These strips have not been used very reliable in clinical trials to monitor ketosis in people following ketogenic metabolic therapy. And they're also subjective or semi-quantitative. If you look at the colors, it's like, is that light pink? Is it medium pink? It's not very specific. And even the numbers are arranged. They're not a specific number. And these strips were not really designed to monitor KMTs. They were designed to detect ketoacidosis, which is a very dangerous condition that only occurs when there's not enough insulin present in your system. Yes, on a ketogenic diet, your insulin levels will be lower, but you will still have the ability to produce insulin. You'll still have insulin circulating. This typically happens in people with type 1 diabetes before they're diagnosed, or if they have a pump malfunction where they're not getting any insulin, then they can develop ketoacidosis. And sometimes people on certain medications with type 2 diabetes called SGLT2 inhibitors. But for the rest of us, there is virtually no, you're not in jeopardy of going into ketoacidosis, but that's what these strips are used for, to detect ketoacidosis, not to monitor ketogenic metabolic therapy long term. Okay, let's get to the next one. This is acetone, which is measured in the breath. And for this one, you need a device that you breathe into. It's called a breathalyzer. And you breathe in for a few seconds, and then you will get a reading in parts per million. And that's 1 molecule of acetone for every 1 million molecules of air. That's what the ppm means. And the ranges for ketosis based on acetone in the breath are listed here. I have to say, though, that these are still not universally agreed upon. I have done a lot of research reading about acetone, and different machines or meters tend to register differently. There's different methods for testing it. So we do know that anything less than 3 ppm, you're not in ketosis. But in terms of where light ketosis, moderate, and deep start and end, it's still not completely defined. But that's about the range that we know for now. So what are the benefits or the upsides of testing breath acetone? Well, that breathalyzer is a one-time upfront purchase. So you don't need to buy any supplies or any strips for it. You only need to buy it once, but you can test as many times a day as you like, and it won't cost you any more than if you test once. So it's very appealing for people who like to test often. It's non-invasive. It's an excellent marker of fat oxidation or fat burning. Whenever you are burning fat and producing ketones, you will have acetone on your breath, and it's completely pain-free. Downsides are that it's influenced by breathing technique. You do need to breathe in a specific way for a specified number of seconds. And for very young children, that might be difficult. And for older people or anyone with breathing problems, it may not be the best method. But really importantly, based on the available technology of the breathalyzers that are on the market, which are metal oxide sensors or MOX sensors, you can get false positives due to cross sensitivities, and then the sensor on the breathalyzer will degrade over time. And I'll go into that a little bit more detail. So acetone is what is known as a volatile organic compound in your breath, but it's not the only one. There are many others. And sometimes these MOX sensors can misinterpret other compounds in your breath as acetone and give you a falsely high reading. And it's many, many things that we eat and drink and use, like throat lozenges and toothpaste. All of these things can affect the acetone level. Yes, in some cases, you can just rinse your mouth out and test again. But if you're producing hydrogen, then that is really difficult to get rid of. And you may get that higher acetone reading than your true value. And then over time, the sensor gets contaminated because it's exposed to contaminants in the environment. And that will cause permanent degradation of the sensor, so it will no longer give you an accurate reading. It may give you a reading that's higher than your true acetone level or lower. We don't know which way. You also won't get any warning. It'll be measuring your acetone level accurately. From one day to the next, it won't anymore, and you won't know. So breath acetone is really interesting. I think there's a lot of potential for it, but with the current technology, it's just really not reliable. Okay, now we come to beta-hydroxybutyrate testing in the blood. This one requires a finger stick. So you need to use a lancet to poke your finger and draw out blood, and then you insert the test strip into the meter, and with the opposite side of the test strip, you touch it to your finger. And within a few seconds, you will get a reading of your beta-hydroxybutyrate level. And the range for nutritional ketosis and therapeutic ketosis is 0.5 to 5 millimole per liter. I have the different ranges here. Now you can see there's some overlap in moderate ketosis and deep ketosis. And that's because that isn't universally agreed upon either. Some people say deep ketosis starts at 2 millimole per liter. And in fact, in epilepsy studies, that is where they consider it usually to start. But other people will say it really starts at 3 millimole per liter or above. But at any rate, it goes to about 5 millimole per liter. And ketoacidosis is typically greater than 10 millimole per liter of BHB. Sometimes it can happen at lower levels as well, especially in people taking those SGLT2 inhibitors that I talked about. Okay, the advantages to testing your blood, beta-hydroxybutyrate, are that it's internationally recognized as the gold standard for accuracy. It's been used in multiple clinical trials, and it reflects the real-time metabolic state. It is the circulating BHB levels in your blood at that point in time. And it is relatively affordable to test. I say relatively because I understand what is affordable for one person may not be to another. It also depends how often you test, and I'll get to that in my cons section. It does require a minimally invasive finger stick. Okay, so that's subjective. Is sticking your finger and seeing blood invasive? Some people may find it minimally, some people may find it more than minimally. I say minimally painful though, and I'm going to stick to that because the lancets that we use today are very, very thin. They're very small. They're not like the big ones before that really hurt. If there's any pain, it's minimal. When we test people at the booth at conferences that have never tested before, they're always surprised at how really pain-free or minimally painful it is. And then there is a recurring cost per strip. If you're testing once a day or even twice a day, it can be manageable for most people, at least for a short period of time. But if you're testing 4, 5, 6, 7 times a day, long-term, that can get costly. Okay, so now I'm going to give some tips for testing blood ketones, and we can go over this afterwards if you have specific questions, but these are my tips for being able to test and make it hurt the least and get the best results. Okay, choose the right finger. Use the size of your middle or ring finger. Those tend to be the best with fewer nerve endings than the other fingers. And warm up your hands first. Go ahead and rub them together or put them under warm water. That helps to get the blood flowing so that you get enough blood to get the sample. And then adjust your lancet device. Our lancet device from Keto-Mojo goes between 1 and 5, and 3 is in the middle. That's where I recommend that people start. That's usually enough for most people to get it, pierce their skin without causing any pain. Some people with very tough hands or calloused hands may need to go up to a 4 or a 5. And use a fresh lancet every time. This is hygienic. Blood can collect on the lancet, and bacteria can collect. It's just very hygienic to use a new one each time and to get in the habit of using a new one each time. Also, if you use a lancet over and over, it gets dull, and that can hurt more than a fresh one. And this is a big one that I think a lot of people don't see the problem with. Don't squeeze too hard. Get your finger ready first by kind of milking it. I don't know if you can see what I'm doing, but this will, if you kind of milk your finger and get the blood to go up to the top, you can get a really good sample when you pierce it. If you don't do that and you see just a tiny drop of blood and then you try to squeeze it after you have already pierced your finger, that can dilute the sample, and then you will have to redo it because you'll see that the number may not be accurate. It's much lower than you thought, and you'll waste a strip and have to poke yourself again. So get in the habit of priming your finger, and then hold the strip at a diagonal to drop the blood. You don't have to force it in. Hold it at a diagonal and will automatically draw up the blood into the meter. And then keep supplies clean and handy right next to you. So your meter and your test strips, your lancet, your sharps container to dispose of your lancet. And then rotate fingers to prevent soreness, especially if you test often. That's really important. Okay. There are some things that can affect the accuracy of the readings in addition to what I just mentioned. And that is using hands that are not clean and dry. If you have any sweat, oil, sugar, or water, that can affect your reading. So just get into the habit of washing and drying your hands. You don't want to waste a strip because you realize you tested with dirty hands. You can also use an alcohol swab. We do this when we test at the booth at conferences. You can do that as well and just make sure that it's dry before you test. Temperature and humidity can affect readings. especially at extremes. I should say only at extremes. Our meters are meant to withstand a pretty large temperature range, anywhere from 50 to even a little over 100 degrees. But if you're in a very hot, humid environment, it could affect the accuracy of the reading. And you want to store your strips properly. Now, with our strips, this isn't really a problem because they are individually wrapped and they don't get exposed to air, or light or anything like that until you use them. But in the past, we had them in a container, and some other ketone strip manufacturers may put theirs in a container. Just make sure that it's not exposed to light. Every time you open the container, they can be exposed to light and that can degrade them. And make sure that you look at the expiration dates. They're printed on the box of your strips, but also on each individual strip. And we just don't want anyone to place confidence in expired strips. I know people who have said, I used expired strips and they weren't any different, but we say, use the ones that are not expired. Try to use them up, keep track of them, and don't order more than you need at once. And this probably should go without saying, but improper handling of a meter could cause it to become, no longer functioning or no longer accurate. So if you drop your meter or if you slam it down or anything like that, so just, take care of your meter, treat it like the valuable tool that it is. Okay, I'm going to talk about the glucose-ketone index now. And this is a combined way to measure glucose and ketones. Our Keto-Mojo meter is a dual meter, so you can test glucose and ketones with the same drop of blood. You don't have to poke yourself twice. You need 2 different strips, but the same drop of blood will suffice for both of them. And the glucose-ketone index is glucose divided by ketones. Your glucose value divided by your ketone value, but there is a catch. If you measure your glucose in the US, and I'm not sure if everyone listening here is from the US and measures their glucose in milligrams per deciliter, but if you do, then you need to divide that reading by 18 because the glucose and the ketones need to be in like units, and ketones are always a millimole per liter. So you need to convert the milligram per deciliter, let's say it's 80 milligrams per deciliter, you divide that by 18, and that you divide by the ketone reading to get your GKI. Now, if you live in a country that uses millimole per liter for the glucose measurement, you will automatically get a GKI reading on your meter when you test. In the US, you won't see it on your meter. You'll just see your glucose and your ketones, but our MyMojo Health app, which I'll talk about later, will automatically calculate your GKI for you. So you don't have to divide the glucose by 18. So the GKI is really just a simple ratio of glucose in the blood to beta-hydroxybutyrate in the blood. And it was originally developed for people who were undergoing ketogenic therapy for brain cancer, a specific type of brain cancer called glioblastoma, which is deadly. It's very, very serious and has a very high mortality rate. And glioblastoma cancer uses glucose very efficiently to grow. It actually uses glucose in the cytoplasm of the cell, not the mitochondria, under no oxygen conditions. That's fermentation. It's a different way to create energy. The mitochondria of glioblastoma are defective. So everything is done outside of the mitochondria, and they can't use ketones at all. But the healthy portion of the brain can use ketones. And glioblastoma tumor is just a small portion of the brain. So by following ketogenic metabolic therapy and giving the healthy portions of the brain fuel that it can easily use and preferentially use, and depriving the glioblastoma tumor of the fuel it needs to grow, we can hopefully prevent progression of the cancer and also help make the therapy better, help it work better while protecting the healthy cells of the brain. And in recent years, the GKI has been used in neurology and especially in metabolic psychiatry, because as I mentioned, sometimes people with mental health conditions and neurological conditions cannot use glucose very well. So by looking at the GKI, we can see how much of the brain is using ketones in relationship to glucose. So a lower GKI means that you are using more ketones and less glucose than somebody who is not following these therapies. Okay, Now I'm going to talk about specific ranges for people with mental health conditions for glucose, ketones, and GKI. But I have some caveats before I start. All of the information that I'm going to share is based on clinical studies, case reports, and clinicians who use KMTs with their patients with mental health conditions. There are no formal guidelines. We're still kind of learning what works best. So I want to make that very clear and to say that personalization is key because individual responses really do vary, even in people with the same diagnosis. So really important to understand that, regardless of the ranges that I give you. And then the GKI targets are based on blood glucose and ketone levels measured consecutively. So they need to be measured at the same time in order to get that ratio. If you test your glucose and then you test your ketones 10 minutes later, you're not measuring at the same time. Glucose can change pretty quickly. So you really want to measure them within a couple of minutes of each other. And if you're doing what I said before, just prick yourself one time, use that one drop of blood for both the ketone and the glucose measurement, then you've got that covered. Also, at least 3 hours after eating, because anytime you eat food, that will temporarily affect your ketone levels and usually your glucose levels as well. So I'm going to give some target ranges, and I have some mental health conditions listed here. I understand there are other mental health conditions where ketogenic therapies are being used and ketones are being tested, but for this, I wanted to use published data where they talked about the glucose ketones and the GKI. So that's bipolar, depression, anxiety, schizoaffective disorder, and PTSD. So these are general recommendations for fasting glucose, somewhere between 70 to 99 milligrams per deciliter. And I have the millimole per liter there just in case anyone listening monitors their or measures their glucose that way. And 70 to 99 is standard. I realize that some people may have lower glucose levels. If you feel well and your glucose levels are in the 60s, that's okay too. If you're doing extended fasting, you often will be around 60 milligrams per deciliter. But as a general rule, if you're actually following a ketogenic therapy, usually somewhere between 70 and 99. And then blood ketones or BHB, 1.5 to 5 millimole per liter. That's a pretty large range. And not everyone is going to need to shoot for the upper part of that range, and nor should they. This is very individual, and some people may even get benefit below 1.5 millimole per liter. They may only need to be around a 1. But typically, what we're seeing in most of the studies is around 1.5 to 5. Now, some people will get benefit maybe at 1.5 to 2 millimole per liter and not really feel any better or any different when they're higher than that. Other people will say, I absolutely need to be above 2 millimole per liter. I really feel even better when I'm at 3 or higher. That's wonderful. That's what testing can tell you, what level you feel best at. But on the other hand, sometimes ketone levels can get too high for certain conditions. For instance, in bipolar disorder, having ketone levels that are too high can actually lead to mania, cause a manic state. We've seen it happen. It's actually been reported in some case reports, and I've heard of it happening in people as well individually. So if you have bipolar disorder, you may have a threshold you need to achieve. You may need to be at around 1.5 or 2, but you might not be able to be much more than 3 millimole per liter. Really very individual, and this is why I highly recommend working with a clinician who understands ketogenic metabolic therapy. It can help you figure out what is the very best optimal ketone level for you to shoot for. The same thing goes for GKI. I have 1 to 3 written here, and that's ideal. It's not possible all the time for everyone, but that is typically where we see the greatest benefit. That's a moderate, usually a deeper ketosis. Dr. Lori Calabrese, who is a psychiatrist, she wrote up a case report, and she considered anyone to be in ketosis if their ketone levels were above 0.8 millimole per liter and their GKI was below 6 millimole per liter. Okay, now let's talk about testing and tracking your glucose and ketone values. There are different ways that you can do this, different times to test, and one is in the morning after an overnight fast. But I don't want you to wake up, jump out of bed, and test right away. And that's because in the early morning hours, your body releases hormones, cortisol and human growth hormone, and these can increase glucose levels a little bit. But even if glucose only goes up a bit, anytime it rises, that's going to prompt your pancreas to produce insulin, and that will temporarily reduce your ketone levels. So we don't know exactly how long it's going to take for each person to see their ketone and glucose values come back to what's baseline. We know that usually in people who are more insulin resistant, it can take a little bit longer, but some people might not need to wait very long at all. So I usually recommend people do a test 3 days in a row, 3 different times. So test 30 minutes after you get up, test 1 hour after you get up, and test 2 hours after you get up. And don't eat any food in that time. You can drink water, no problem. And then you can see kind of a pattern of when your glucose and ketone levels improve. And then you can test at that time. You only need to test 3 times in the morning once. And try to test at the same time every day. I know it can be tough in the morning when you have a lot of things going on and you have kids, and you may not be able to test exactly the same time, but keep it relatively consistent, because the more consistent you are, the more reliable readings you're going to get, and the easier it will be to notice patterns. Now, you can also test in the late morning or like late afternoon after you've eaten a meal, but make sure it's at least 3 hours after you've eaten. And that's because anytime you eat, your ketones will temporarily go down, your glucose levels will often go up, and you really just want to minimize any effect of food when you test. So by waiting at least 3 hours after you've eaten anything or drunk a beverage that has calories, then you can get a more consistent reading for your ketones and glucose. Now, I found that most people have their highest ketone readings in the late afternoon. So if, let's say you eat lunch around 12, I would test before dinner, like 4, 5, or 6, depending when you eat. And that will probably give you your highest ketone value of the day. And again, try to stay consistent. Try as best you can to test your afternoon or late morning if you're doing it in the late morning before lunch. Try to do it around the same time every day, keeping to the same routine. Okay, there's another time that you can test, and that's for responses to specific foods. So, of course, a ketogenic diet is very low in carbs, but sometimes foods that don't even contain a lot of carbs can affect people, either raise their glucose or lower their ketones, or both. And these could be like sensitivities to foods like nuts or certain vegetables or possibly dairy. That's a big one. Or maybe an ingredient that you suspect may be causing you trouble. So this one requires 3 tests. So you test before you eat the food. You eat a modest portion of the food, not a tiny portion, but not a huge portion, but just, the amount of portion, a normal portion for you. And an hour after eating that food, you test again to see kind of the where the major effect is. 1 hour will be usually the peak of your ketone drop and the peak of your glucose rise. And then test again 3 hours later to see how well your levels have recovered back to baseline. And make sure to write down everything that you eat, the times that you test, and the numbers that you get, so that you can then assess your response. So for ketones, you want to make sure that the ketone level doesn't go down more than 1 millimole per liter at that 1 hour mark. So, 1 millimole is pretty high. So if you started off at like 1.5, that would mean no more than going down to 0.5. You wouldn't want to get less than 0.5. And for glucose, and it should return to baseline by 3 hours. So even if your ketones drop by 1 millimole per liter, they should go back to your pre-meal test or your pre-food test by 3 hours. And then for glucose, there should be no more than a 30 milligram per deciliter rise, or if you're measuring in millimole, 1.7 millimole per liter rise at that 1 hour mark. And then it should return to baseline by 3 hours. Now, if you see more than a 1 millimole per liter drop in your ketones, or more than 30 milligram per deciliter increase in your glucose at 1 hour, or neither of those values get back to baseline in 3 hours, that tells you that the food is probably not one you should be eating very often, or if you do, just eat a very small portion of it, because it is impacting your glucose and ketones pretty significantly. Okay, now this is a big one. How often should you test? People ask me this all the time, and I say at the beginning, we really want you to test a lot because it gives you such valuable information. You're still kind of learning how your body responds to certain foods and also what ketone level you feel best at. So we recommend testing once, ideally twice a day for the first 2 to 4 weeks. And that should give you enough information to really fine tune your diet and figure out that optimal ketone level for you. After about a month, you really shouldn't need to test that often, maybe once a day or as little as once a week, depending on who you are. Now, if you enjoy testing every day or twice a day, continue to do it. But once you really know what you need to do to stay in ketosis, you need to test less frequently than at the beginning. And then occasionally testing for food sensitivities when needed. Okay, so I spoke about the MyMojo Health app a little bit earlier when I talked about the GKI. This is an app that you download onto your phone, and it allows you to track your ketone and glucose and GKI levels long term. And it's very easy to do. You simply, while your meter is still on after you've tested, you simply touch that third button there where it says last 28 days, that middle button that looks like two different arrows. That's the sync button. You simply push that button or you tap it, and your readings will instantly upload to your MyMojo Health app, and they will be stored there indefinitely. So you can keep track of them, day by day, week after week, and look back on them over the months or years to see how your readings have trended, how they've changed over time. So it can give you a lot of valuable information, and you don't have to write everything down or scroll back in your meter to see the readings. And there's a number of ways that you can look at the data, and I'll show that on the next slide. But you can just look at the readings straight, but there's also graphs, and there are bar charts, and there are other ways of looking at the data that can make it really interesting and make it just easier to see how you're doing overall. And you can also download your results into a CSV file that you can share with your provider so they can look at all of your results. And if your provider is on our MyMojo Health practitioner platform, they can actually invite you to their practice so that every time you test your ketones and use your MyMojo Health app, your ketones and glucose, all of that information, that data will be sent to them in real time so they can review it. So that's another thing that you can do for practitioners if your doctor or the health coach or anyone that you work with is using the MyMojo Health practitioner platform. Your data is very secure. This platform is triple encrypted, and it's also HIPAA compliant, so it's very safe and confidential. And I mentioned the GKI. You will not see that on your meter. You will see it in the MyMojo Health app. It's right in the middle there. That 2.5 is the GKI. The glucose and ketones are underneath it. So this is where you can see all of your GKI readings. And you can also connect your MyMojo Health to other apps. We have integrations with Chronometer and with Apple Health, and also the Withing scale and the Aura Ring. And I think we have some others as well. But this is really nice because then you can see all of your data together on your MyMojo Health app, and you can see your MyMojo Health data, your glucose and ketones and GKI on the other apps in some cases. So that's really nice to be able to look at all the data together. And then you can also order your supplies, strips or lancets or anything else that you need right from the app. So this is just a little example of how the MyMojo Health charts display. So this one is kind of showing you your readings over a 3-month period of time and how well you fall within the ranges that you set for yourself. You can set your glucose and ketone and GKI goal ranges. So that's a really nice way to look at them. You can also look at graphs. That's up at the top. Now the graphs will only allow you to see two readings, two values. So that could be glucose and ketones or ketones and GKI, or however you would like to look at them. But there's the bar charts underneath, and you can look at that again. You can pick the timeline that you want to see. You could see 1 week at a time. You can change it to 28 days. So you can see kind of month over month, or you can look at long-term, how you're doing over several months. So it's very, very individualized and can be used however you like it to be. Well, thank you so much. And if you have any questions, you can email me, Franziska@ketomojo.com. That's our website, ketomojo.com. We have a section where you can look at MyMojo Health. We have articles, we have recipes. We have a lot of information for you. And as I said, thank you. And I hope to see you again soon.